Hello, everyone. We are back with another webinar this month. So today specifically, we are talking about toxicity, which we have been, thank you. I actually blow dried my hair. This is what everybody says when I blow dry my hair. They're like, your hair looks nice. So we are continuing to talk about toxicity this month. Specifically today, we're talking about different types of toxins that are associated with neurological decline. Very specifically, different toxins that can be associated with dementia as well as Alzheimer's. And I felt that this was really important to cover, primarily because this is something that is becoming an epidemic. It is really, really heartbreaking as so many patients come through my doors and, they're struggling with their memory and they're really struggling with their mental health. But then in addition, they are talking about loved ones that they have lost, due to Alzheimer's. But leading up to that, from the progression from dementia into the Alzheimer's, is really just heart-wrenching to hear about. And I really want to give people better information so that they understand that this is not about genetics. This is not about being powerless. This is not about, we have no idea where this comes from. And this is also not about that a vaccine is going to one day fix this, because when I hear about research that a vaccine is going to fix Alzheimer's, it's one of the craziest things. I can't even wrap my head around it, because there are so many known factors that are playing a role in our neurological decline. And some of those factors is toxicity. And when we talk tonight, you're going to realize that there are so many different avenues that we are being exposed to toxins that are neurotoxic. And unfortunately, some of these toxins that we talk about today are in very commonly prescribed medications. So I'm here to shed light on this so that people have a better understanding of, some of the things that may be contributing to their current neurological health, but also what are the things to know about to avoid so that we don't necessarily end up with that diagnosis down the line. And also so that we feel more empowered, so we're not just sitting around being like, oh, when am I going to get this? When am I going to develop the dementia? Because I think that that's where a lot of people are at, is they just feel extremely powerless to these conditions, and they truly believe that genetics are one of the most common reasoning behind the development. And tonight we will talk all about how there is so much more to the story. And these are different toxins that you potentially are being exposed to right now. And also these are toxins that you can avoid. So as we kind of dive in, for those of you that are on Instagram with me, definitely feel free to direct message me with your email if you are looking to have, actually get the webinar, because it is going to cut me off in an hour. So, of course, this is now being funny. So just give me 1 second as I scroll all the way back in my PowerPoint. But overall, just kind of a little bit of a background on myself and the practice. So you are probably like, who is this person? And, how do they even know about this specific topic? Is I am a physician at Integrative Wellness Group. This keeps doing this to me. So I don't know why this keeps doing this. Anyway, I'm a practitioner at Integrative Wellness Group. My primarily role working with all different types of patients with a ton of neurological disorders. And primarily I do this because this is something that can be avoided. And there is lots of testing out there that exists that can actually give you more information about your neurological system that is really just not necessarily just about MRIs and CAT scans. So with that being said, with my practice, we have definitely evolved over time, and it was really by asking better questions and also using better testing. So guys, I'm gonna just click this because this is gonna do this to me again. And I apologize as I have to go all the way back in my PowerPoint, so you're getting like a sneak peek. But this, for some reason, is not letting me do it a different way. So we're almost there, we're almost there, we're almost there. There we go. Okay. So overall, I work with a variety of different conditions, neurological being one. And by default, I've actually learned a ton about toxicity. And it's primarily because as we started to leverage different technologies, we started to uncover that there were different toxins, and some of them we've never actually heard of, that were playing a very significant role in people's health, but also people's neurological condition. So as we continue to leverage some of these technologies, we got exposed to more and more toxins, and we kept kind of continuing to research these different things. And what we realized is that it's not actually just about the toxins that you have been exposed to in your life. It's also the exposures that your mom had, maybe when you were in the womb, or even the toxicity that your mom had through her life that ended up in her tissues that got into the amniotic fluid. So there are many, many possibilities when it comes to toxicity. And the reason why I've realized this as well outside of the technologies is because when I had young children coming in, even as early as 4 or 5 months old, these kids being broken out in full body rash or having massive constipation or abnormal bowel movements that are discolored, these parents were like, how has this happened? My kid is so young and they're being breastfed. I'm doing all the right things. Like, what possibly can have gone wrong? And as I start to do testing on these kids, I uncover that toxicity is part of the puzzle. And these toxins are obviously not from their personal life experiences or life exposures. These are toxins that were potentially in mom's body for many years, or things she was exposed to while she was actually pregnant. So overall, the toxins are not always about what you have dealt with and been exposed to in your life, but there is certain toxins that have actually been passed down generation to generation. So this is a really interesting story about mercury specifically. So mercury is one of the most well-known neurotoxins, and it specifically compromises the neurons. It causes neuronal death. It can be a huge culprit behind the development of dementia, Alzheimer's, Parkinson's, and a variety of other neurological conditions. But what they have said, or what they've proven in research, is that mercury has actually been passed down generation to generation. And the reason being is because back in the day, in the late 1800s, most people wore hats, top hats specifically. And what they actually used to do to the top hats is they would actually dip them in mercury in order to weatherproof them. So when it was warm out and people were wearing these top hats, mercury becomes liquid. It also has the ability to become vapor as well. But in a warmer temperature, it would start to actually come off of the hat and get into the skin or even the eyes of the person wearing it. So this is actually where the term the Mad Hatter came from, because if the mercury seeped in and started to compromise the neurological system, people would actually go crazy and lose their mind. So when it comes to mercury, this is something that started a long, long time ago and has been passed down generation after generation. And this is one of the primary toxicities that people have fresh out of the womb. So this is definitely something to understand, because the common conversation that I have on a day-to-day basis when I'm reviewing the toxicities that people have, and they're like, how is this possible? How did I get exposed to this? I've never bleached my hair once. I've actually had this conversation today with a 15-year-old, and she's never dyed her hair, and mom doesn't use bleach in the house. But bleach was a primary toxicity for her neurological system that was actually causing epilepsy. So this is definitely something that is not always super clear, but it takes asking better questions, and then you're able to really piece the puzzle together. So some of you that are kind of new to even the webinars or knowing who I am as a practitioner, just a little bit about myself, because this is very relevant to the topic today, is that I didn't necessarily get into this field because I was super sick and somebody our functional medicine doctor was finally able to figure out what was going on with me. And then, I healed from that process. It was actually the opposite. I actually thought I was very healthy. I thought that I ate well and exercised. I really thought that, I was doing pretty well. And when I actually did my own testing, I realized that I wasn't healthy at all. And what I realized is that most of the symptoms that I dealt with were my normal. They were my normal because they came and went. They were my normal because a lot of other people dealt with them. They were my normal because they were mild most of the time. And even when they were bad, I usually had an excuse for why. Oh, I had heart palpitations today. Oh, I drank too much caffeine. Oh, I didn't sleep well. Oh, it's probably because I ate late. Oh, my stomach really hurts today. Oh, it's probably because I had ice cream. There was always a reason why. And I know this is very relevant to those of you that are listening, because we usually have, we're usually trying to blame our symptoms on something. And a lot of us have also had our symptoms come on gradually, which allows us to just normalize them. And one thing that I like to tell people, because I think this is really relatable, and I know there's a lot of negative self-talk for people, is that when I did my testing, I had really, really bad mercury or toxicity. And part of the contribution to that was all the fish that I ate. I was a pescatarian for about 10 years. And at that time, I thought I was healthy. I thought I was doing great by not eating pizza and baked ziti and, all of these other processed foods. But I would go out and eat sushi, and I would get salmon, and I was always eating fish, thinking that was the better option. Little did I know that there was a such thing as wild fish versus farmed fish, and that fish had parasites and everything else. So that's another webinar for those of you that are like, what does that mean? But I ended up getting my mercury exposure primarily from fish. And when I really sat back and I thought about it, what I realized is that when I was in school, I had a lot of negative self-talk saying, you're not cut out for this. You can't be a doctor. You're not smart enough. You're not good enough at organic chemistry. Why do you have to read this page 3 times to comprehend it? Why do you have to study so many more hours than the average person? And I easily could have given up, saying, I'm not cut out for this. I'm not smart enough for this. It's pretty crazy because I had this massive toxicity factor that was working against me. And fortunately, I was able to power through, mainly because I'm crazy stubborn. And the more I would tell myself I can't do it, the little other voice inside of me said, screw that, you can do it. But more importantly is that, there's a lot of younger adults that are struggling. And they don't realize that mercury can play a very significant role in addition to the other toxicities that we're going to talk about tonight. So we are 13 past 7. I want to give you guys the opportunity to shut down the email browsers and tell your kids to leave you alone for the next 20 minutes and tell everyone else to kind of just give you this time that you can really dive in with me, because the information we're going to talk about tonight is not your run-of-the-mill information. We're not going to sit here and, talk about like the magical one pill that's going to cure everything, or the one food that you're eating that's going to cause you to get dementia. I'm actually going to give you quality information that is very clinically applicable and real life. First and foremost, when I go through all of these exposures and all of these toxins tonight, it is not your fault that you don't know this already. It is not your fault that you had no idea that toxicity could have been a player in that. It is not your fault. There is so much information out there. We obviously are relying on physicians to give us the best quality information and to give us a cure. And sometimes that's not happening. And then we, try to seek out, how can we figure this out on our own? But we get paralyzed because there's so much information and there's so much conflicting information. So it's not your fault that you haven't necessarily been able to get where you're trying to go, or you haven't been able to help that family member. So it's all about getting quality information. It's about using better testing. And it's really about understanding that every single person is different. That if you have 2 people that have memory loss, dementia, or Parkinson's or Alzheimer's, their protocols should not be the same because they are two completely different people and they usually have a completely different root cause as to why they've developed that condition in the first place. So with that being said, it's not, I should say our fault or that we haven't been able to understand this. And I say this because there are so many different specialties. And of course, when we are dealing with something like memory loss, Parkinson's, Alzheimer's, dementia, we're usually going to a neurologist. And we are expecting that neurologist to understand this condition inside and out. But when we talk about toxicity, that's a toxicologist. And then if we talk about an autoimmune condition that could be associated with the brain, that is going to be an immunologist. So it gets really confusing because we end up working with all these different physicians and they're not necessarily always piecing the puzzle together. And this really brings me to the basic point that a lot of physicians are just completely overlooking basic physiology. And we overlook the idea that most of the neurotransmitters that affect the brain are actually made in the gut. So you could have someone who's dealing with depression, memory loss, or some other type of mental illness, and they could also be dealing with irritable bowel syndrome. But maybe the irritable bowel syndrome isn't bad enough for them to be treating it. Or maybe their gastroenterologist knows nothing about diet. So their IBS is going untreated, but then they're also being treated for some type of, with an antidepressant, or they're being treated for some other type of mental illness. When in reality, if they were to fix the gut, most of those other symptoms would go away. So again, like I said early on in this is not about us looking for the one pill cure or for us looking for the vaccine cure or even the one dietary cure. When it comes to Alzheimer's, dementia, and other types of neurological conditions, these are multifaceted, and toxicity can definitely be a player in this, but there are other things that we have to consider. And those are some of the things that I'm going to touch on in addition to toxicity tonight. But when it comes to toxicity, guys, we are being exposed everywhere. We're being exposed from the food that we eat, from the things that we put on our beautiful landscaping, from tap water to swimming in pools, to our personal products, baby products, furniture. If you live in an old building, you have risk for asbestos and lead. If you live in a new building, you get off-gassing for 20 years from the spray insulation. And then we have dental materials. That's one of our focus tonight, is talking about the things that are being put into your mouth that nobody is necessarily revealing can be toxic to your brain. And then on top of it, we have cosmetic surgeries. So there are a variety of different types of cosmetic surgeries that we are getting done on a regular basis that can contribute to toxins as well. They've actually found 172 toxins in breast implants. So this is not my opinion. This is not my research. This is clinical research that is being done on massive groups of people. So guys, this isn't necessarily just like, oh, it was a couple of people. These are real life studies that you can find on peer-reviewed sites. So some of the biggest things that I see in my clinical practice in relation to neurological decline, again, dementia, Alzheimer's, or even memory loss. DDT. Everybody thinks that DDT is gone, vanished out of the environment. DDT is one of the most well-known pesticides that they actually stopped using because they found huge correlations to neurological issues and huge correlations to cancer. I still find DDT in people's systems. So when I have my patients that grew up in areas that they would have the mosquito trucks go through the neighborhood and they would chase the trucks. I hear this story all the time. They say that we used to chase the truck, or we used to ride our bikes behind the truck. Those trucks were releasing DDT back in the 60s and the 70s. So again, going back to the same conversation about the mercury, is that much of this is being passed down generation to generation because this is a toxin that burrows itself in our connective tissue and our fatty tissue. The other one is going to be aluminum. Aluminum is something that most of you are putting on your armpits every single day because it's in all of antiperspirant. It's in canned food, there's aluminum foil, and there are many other avenues of aluminum that we get exposed to. Mercury is in the silver fillings that have been in your mouth. I don't care if they're out. If you had silver fillings in your teeth for even 1 year, that mercury leached into your tissues. Mercury is in fish, especially the people that eat tuna, swordfish, shark, the large fish. Lead, it's not just in lead paint. Lead is in your chapstick. Lead is in your lipsticks. Lead is in most of your cosmetics. Women, go on Think Dirty, the app. It's on there. It'll reveal it. And what's even more fascinating is that when I was at a health food store, there was chapstick right at where the cashier was, and it said lead free. And I was like, what? And that's actually how I started to research it, that there's lead in most chapsticks. Glutamate toxicity. So this is going to definitely be from our MSG exposure. MSG is most well known in Chinese food, but most of your prepackaged sauces, condiments, salad dressings, that's when you go to a restaurant, especially like a chain restaurant, and you're like, I don't understand why my stomach hurts or why I got a headache. I ate so healthy. I got the salad. Most of those prepackaged dressings are going to contain glutamate. Or MSG, I should say. Botulinum toxin. So botulinum toxin can come from canned foods. It also is the primary ingredient in Botox. Botox is neurotoxic, and we are putting it in our foreheads. We need to really rethink some of these cosmetic procedures and the long-term effects of it. Dental. I'm going to go way deep into dental. Another thing that's associated with dental, though, is 5G and cell phones. So if you have silver in your teeth, within 7 minutes of being on your cell phone held to your face, it actually mobilizes the mercury out of your filling and allows it to get into the tissues, the glands, and the nerves of your face. Fluoride. Most of us are getting fluoride treatments with most of our dental checkups or cleanings. That fluoride is going directly into the glands of your mouth, your gums, your nerves, etc., which is very close to your brain. If we have done drugs like ecstasy, MDMA is the other name, Molly, these are neurotoxic. They actually destroy your neurons. Alcohol, also ethanol, these are also neurotoxic. And then a very interesting toxin called tetrodotoxin, which is actually from a puffer fish, also a sunfish, and this whole family. Not many people are being exposed to this, but don't go to weird islands and eat weird fish. Just don't do that. But some of the big ones that a lot of us are doing on the regular, canned tomato sauce. This is really not just canned tomato sauce, but for whatever reason, canned tomato sauce specifically has higher levels of BPA than other types of plastics and other types of prepackaged items. But BPA, a lot of us have heard because we're trying to, look for plastics that are BPA free. But canned tomato sauce, so when you're making your lovely like homemade tomato sauce and it's still coming from a can, please don't do that because you could potentially be getting exposed to this BPA, which is very neurotoxic. Most of the char on your grilled meats is going to be another exposure to neurotoxicity. Peanut butter. Peanut butter contains something called alpha toxins. Peanut butter is extremely toxic to natural peanut butter versus organic versus Jiffy versus whatever. All peanuts grow with alpha toxins. So you have to be aware of overconsumption of peanut butter can very much be toxic to your neurological system. Mercury is in tuna. It is in a variety of other fish as well, but tuna and swordfish are going to be the two most abundant with mercury. I had a patient for a while who was a fisherman, and what he told me is that he never filleted a swordfish that did not have tumors. And primarily those tumors stem from toxicity. So this is something that ask a friend who's a fisherman. They will tell you how many issues are happening with the fish, that they're finding plastics inside of the guts of the fish, that they're finding tumors in these larger fish. They're finding deformities. There's very, very interesting things happening in our oceans, and we really need to be cautious about the fish that we consume. One of the big ones is butter flavored microwave popcorn. So this is something that is delicious, but extremely toxic. The chemical is called diacetyl, and this is something that is actually correlated to popcorn lung, go figure. And it's primarily because it causes irreversible lung damage. This is also the same chemical that is being found in our electronic cigarettes and our vaping devices as well. So when it comes to this specific chemical, it's not just about the popcorn, it's also going to be about these e-cigarettes and vaping. So we're trying to get away from the cigarettes, but we're exposing ourselves to a completely different chemical that is equally as toxic to our respiratory system, but even more toxic to our neurological system. So another thing that I came across in the event of researching all of the neurotoxins that we get exposed to was a very interesting neurotoxin called sarin gas. So sarin gas, as I'm researching it, they're kind of talking about it as being a germ warfare. So they were using it primarily, against other countries to, act as warfare. But what they've actually found is that there was an exposure in literally July 2019, so last month, that there was a scare of sarin gas being, or actually being excreted at one of the Facebook headquarters. So this is something that's not like eradicated and not being used anymore. This is something that is still out there and that is being used. So there is potentially an exposure for it. Obviously, it's not as common, but I found it very interesting that it was literally last month that there was a run-in with this specific gas. So the other big thing that we're going to talk about is different toxins that actually come from different pharmaceutical exposures. And there is a massive, massive list of certain types of pharmaceuticals that have been linked to neurotoxicity. So a lot of them fall under the realm of cancer treatments. And then there is also known toxicity that comes with Adderall and Ritalin. Primarily, the neurotoxicity that happens through the Adderall and the Ritalin is because it damages the dopamine neurons. So just so you understand dopamine and how this actually plays a role later in life is if you start to have dopamine deficiencies, this is when you start to have a lot of problems with addiction. So there is now being a correlation with children that are on Adderall and Ritalin that later down the line, they have a lot of issues with addiction. And sometimes these addictions are exercise, but sometimes these addictions are drugs, alcohol, food, sugar, things like that. So we have to really think about the long-term effects of using different drugs that are actually manipulating the chemical pathways of the brain, because these can easily be compromising our body's ability to make these different neurotransmitters on our own. And if our body loses the ability to make these neurotransmitters, we are going to have issues down the line. And that could be addiction, it could be depression, which can then obviously lead to more serious things like suicide. And unfortunately, that is becoming so much more prevalent right now is, you're hearing about these kids that are, committing suicide. And it's literally just like heart-wrenching because the statistics are higher than they've ever been in the past. So when it comes to different pharmaceuticals, I kind of broke these down. And this is not, again, my research. These are peer-reviewed articles that I was able to pull this information from. But some of the highest risk for neurotoxicity was two different drugs. This is like the highest risk of these two drugs. One is called vincristine, also known as vinblastine. This is specifically used for as a chemotherapy drug in pediatrics. So this is really not supposed to be used unless there is no progress with any other types of treatments. But overall, what they've actually found is that it's going to create massive peripheral neuropathies, which pretty much means you're going to have a lot of nerve damage in your arms and your legs, and even nerve damage to the nerves that go to your organs. So in addition to that, there is another category of drugs that are specifically used, again, as a chemotherapy drug called Taxols. And there's all different kinds, but they've specifically been associated with neuron death. So literally causing neuronal death, and once the neurons have died, they do not come back. So we really have to think about, what are the long-term effects of some of these different drugs that are being used? I know that in many cases, these chemotherapy drugs are being classified as life-saving, but what if this person ends up being a vegetable? And, what if there are other ways to look at the big picture as to why the cancer developed in the first place? And how can you actually work on the foundation of getting the body to a healthier place, getting the immune system to a healthier place? Because these specific chemotherapy drugs are literally being classified as neurotoxic and highly neurotoxic. I'm going to let my dog out because he won't stop whining. Hi, go ahead. Between the PowerPoint today and the dog. So some of the other specific neurotoxins that were associated with medications, there is a very, very long list, but I specifically wanted to point out some of the things that I see most often, and some of the drugs that I often see people coming, or I should say people coming in with symptoms that report that they've taken certain drugs that were very in close correlation to when the symptoms started. So one of those is definitely going to be in the relation of certain antibiotics in the fluoroquinolone family, and then other antibiotics known as Flagyl, Macrobid, which I will talk about more in the next slide. But some of these specific drugs are, one of them is called arsenic trioxide. Arsenic, primary constituent in this drug is arsenic. Arsenic is one of the most known neurotoxins, and this is actually associated with leukemia. There are other drugs that are being used for multiple myeloma that are being connected to actually breaking down some of the major enzymes that run your neurological system. So again, these are drugs that are potentially solving one problem, but they are causing a variety of other problems. So we really have to think further about this, but some people just need to be aware of this. There are many people that are going through different types of cancer therapies, multiple myeloma therapies, etc., that are not necessarily being told about the other side of how this is actually going to damage their neurological system. The fluoroquinolone family, this is your Levaquin, guys. This is your Cipros. These are antibiotics that are being given out quite often. And these specifically they not only break down connective tissue, which is why Levaquin, one of the most well-known side effects is rupturing your Achilles tendon. Your Achilles tendon is literally the strongest tendon in your entire body, that this medication has the ability to break that down enough that it could tear and rupture. So in addition to that, this is also being now associated with insomnia, seizures, convulsions, psychosis, and also polyneuropathy. So these are all different versions of neurological damage. And we also have this other family of antibiotics, which nitrofurantoin is one name, but also known as Macrobid. Macrobid is definitely an antibiotic that should be used as a last resort, but this is very, very toxic to the carbohydrate metabolism of the brain. So our brain runs on glucose. So if you break down the ability for your brain to use glucose, your brain gets zero fuel, which means you are going to have memory loss. You're going to have short-term memory loss, long-term memory loss. You're going to have brain fog. You're going to then potentially be at risk for the development of things like dementia and Alzheimer's. So just a simple round of an antibiotic can actually completely compromise your neurological system. I know somebody's asking about birth control. Birth control is not neurotoxic, but birth control depletes your folate and your B vitamins. So if you get depleted of your folate and your B vitamins, you actually are missing most of the precursors to how your brain makes serotonin, dopamine, acetylcholine, all of your neurotransmitters. So just to kind of keep it really simple, if your brain kind of goes from amino acid to amino acid. So if you eat turkey and your body gets exposed to tryptophan through the turkey, then that tryptophan eventually gets converted into serotonin. But it needs things to convert into serotonin. Some of the things that it needs is zinc, folate, and B vitamins. So if you're missing those items, then you can't make that conversion. And that's going to be one of the reasons why you have lack of serotonin and potential depression. So this is definitely something that's important because a lot of medications that we take outside of what we're talking about today, with like these medications that I'm talking about on this PowerPoint, these are toxic to your neurological system, like literally causing damage to your brain. Then we talk about other medications that just deplete most of your nutrients, and then that has issues with the neurological system, but in a different way. It's because now your brain doesn't get the nutrients that it needs to fire properly and to also produce your hormones that help with your memory, and the hormones that help with your mood, and the hormones that help with your energy. So there's many factors to be considered when it comes to the side effects of certain medications. So Lexapro was another question. So when it comes to Lexapro, Lexapro is an SSRI. So what this is doing is it's shutting down the reuptake of serotonin. So let me just like try to make this as simple as possible. Is that you have serotonin that gets produced in your gut. You also have aspects of your brain that produce serotonin. So then you can have a bunch of serotonin floating around, but your receptors have to pick it up. And those receptors pretty much use the serotonin and help you to feel good. So the concept of an SSRI is, okay, if you have all this serotonin floating around, then the receptors are going to pick up more and more. But normally what happens is if you have this excess serotonin, it gets recycled. It gets reuptake by other glands, by the synapse. So it shuts down that reuptake and it just allows for a boatload of serotonin to float around. But the thing is that if you have a boatload of serotonin floating around, it doesn't necessarily mean that the receptors are going to use it. In addition to that, if you have too much serotonin floating around, that actually makes you anxious. That's why they have something called serotonin syndrome. And serotonin syndrome is thought to be like this extreme set of symptoms, but most of my patients that I work with have some level of serotonin syndrome, especially if they've been using different types of SSRIs or MAO inhibitors. So we really need to think about these things can be used in the short term to really help us, get over that hump. But when we use it over the long term, we could potentially create this excess of serotonin, which starts to make us anxious. But in addition to that, you also start to compromise your body's ability to make serotonin on its own. Think about it. If you have a bunch of serotonin floating around, your brains or your body's going to be like, whoa, where'd that come from? Well, I should stop making it because there's extra. So it creates a negative feedback loop. And this is very common with a lot of different types of medications outside of just SSRIs. So some of the other major things that came up in some of these different neurotoxins is there is actually one of the drugs on the previous slides is a specific drug that was actually marketed to pregnant women to help them with sleep. And this was actually then linked to a variety of birth defects and malformed limbs. So the interesting thing is that they stopped giving it to pregnant women, but they actually still use this same drug in conjunction with dexamethasone, which is a steroid, for the treatment of leprosy, which is a skin issue, and multiple myeloma. So again, guys, we're using these medications to help to treat, you know, one condition, but then we are creating massive toxicity to the neurological system, which is literally the most vital system because it controls everything. If you don't have your brain, you really don't have anything. So we really need to be our own advocates and research the drugs that we are on, and we need to research the drugs that we are being recommended. Because, you know, people are going through the devastating diagnosis of cancer or multiple myeloma, and then they are going into fear-based mode, and they're like, let's kill it. We need to kill it. We need to handle this. We're going to pull out the big guns. We're going to deal with this, and we're going to beat it. And then you unfortunately watch these people have then a variety of other issues down the line. And a lot of it is neurological based, or tons of scar tissue and pain from radiation, or a very compromised immune system. So no matter what you choose, is you have to really seek out your next step. If you're going to go through chemotherapy, if you've gone through chemotherapy, if you've gone through radiation, if you've gone through any of those therapies, you need to be able to then fix the damage that was done by those different therapies. And that's really a matter of working with a practitioner that is their specialty, of looking at everything, looking at the big picture of your body. You know, what needs to be repaired? Is it your immune system? Is it your gut? Is it your lymph nodes? What is it? Because there is no possible way that you do not have residual damage from these types of drugs. So one of the things that I talked about early on, for those of you that have been on the webinar since we started, but I talked a lot about toxicity, and one of the primary things that I mentioned was mercury, and mercury being an exposure from fish, being an exposure from the silver fillings that are in your mouth. But in addition, we're also dealing with other types of metals that are associated with neurotoxicity. So one of the actual most well-known pesticides that are being used is called methyl bromide. And methyl bromide is not only damaging our ozone, but it's also creating toxic brain syndrome. This has been proven in quite a few different cases, is if you're being exposed to this specific pesticide, and this could be from living near a farm, or it could be from food exposures, that this is actually creating a very specific type of inflammatory process in the brain due to this compound. And then the other major metals that we need to be aware of is going to be lead, arsenic. Arsenic is on most of your rice, by the way. So if you're the person who went gluten-free and now you eat tons of rice and you eat Kind bars that have tons of brown rice syrup, you potentially could be getting exposed to arsenic from those sources. And then another one too that is classified as toluene. Toluene is in all of our nail polish. It's in a lot of our hair dyes. It's in our keratin treatments. It's in a lot of these different personal products that we are using. So toluene is something that is very, very present in the beauty industry, but the long-term exposures or high dose exposures is going to definitely be linked to slow neurological decline that later down the line ends up with something like dementia. So again, this is very, very important for you to be proactive now, so that you are not necessarily just ignoring the fact that you're 30 or younger and you can't remember anything, or you feel like you have brain fog, or you're forgetting childhood memories. Guys, these are all a sign. They are a sign that there is something wrong, and it's a sign that allows you to be proactive now so that you don't necessarily end up with something more serious down the line. I talked a lot about this I talked a lot about certain pesticides, one of them being glyphosate. Glyphosate is the primary chemical that is on most of our food, but it is the primary ingredient in Roundup. So, hairstylists, listen to the webinar last week. There is a lot that I talked about in the personal products. Definitely a lot of good information there. But the first one that I did this month was a lot about the glyphosate. And glyphosate, what they're finding, again, it's Roundup that we're using on our lawns and to kill weeds, but glyphosate is the primary chemical that's being used on most of our produce, especially our genetically modified produce. So if you go to the store and your label on your produce starts with a 4, that's genetically modified, just so you know. If it starts with a 9, it's actually organic. It's very easy to be tricked because most of your stores do not carry only organic. Most people think that Whole Foods is only organic. It is not. They have a variety. They have organic, they have genetically modified, they have conventional. So you need to start looking at those labels. But regardless, what happens is when you have the glyphosate exposure, which unfortunately most of us do, and then you also have mercury exposure from, say, the fish or the fillings in your teeth, and then you also have aluminum exposure, which comes from your your antiperspirants. It's also coming from aluminum cans. It's also coming from aluminum foil. All of those work synergistically together, and it actually becomes extremely, extremely neurotoxic. So it's not about just one of these items, but when they all get together, that is when we are going to start having major, major issues with our neurological system. And one of the most interesting studies they've just done is that the combination of aluminum glyphosate and fluoride, this combination together actually creates false messaging in the brain. And this is when we challenge truths and believe lies. It's almost like some of these compounds have allowed us to become more docile. And when you're sitting there being told, hey, this is good, if you eat McDonald's every day, it has nothing to do with your gut hurting. Or eat McDonald's every day and it has nothing to do with you developing ulcerative colitis. That's like, in reality, if you were to sit back, like that doesn't make any sense, especially because they've shown that you can have a burger from McDonald's sit out for 20 years and it doesn't even get moldy. The bread doesn't get moldy, the meat doesn't get moldy, the pickles don't get moldy, it doesn't get moldy. Like, that's not real food, that's plastic or whatever else it could possibly be. But if you're just being told like, oh, that's healthy for you, yeah, maybe it'll cause you to gain weight, but it actually has nothing to do with your chronic illness or your chronic inflammation or your chronic gut issues. That's what I'm talking about. Is like being like, oh, okay, great. But then, if you eat broccoli every day, then that could help your gut. No, that's not even possible. So they've actually proven this through certain studies that it is actually manipulating the pathways of the brain in order for us to just kind of like not use common sense anymore. Let's put it that way. So there are very strategic ways that you can help to get this out of the body. I do not recommend usually doing this on your own, because if you start, detoxing from glyphosate and aluminum and mercury, you could easily have some really negative reactions. I highly recommend doing this under the supervision of a practitioner. But in addition to that, when it comes to the glyphosate, if you have ever been done some type of stool sample, or you've done some type of testing for your gut and it's actually showed that you've had high levels of salmonella, or you've had high levels of Clostridium, including if you've ever been diagnosed with something called C. diff. C. diff is the bacteria that causes chronic diarrhea that actually can cause you to get so dehydrated that you can die from it. High levels of Clostridium and high levels of salmonella have actually been tied to glyphosate toxicity of the gut. So this is not always about kill, get rid of the bad bacteria. Sometimes it's about detoxing the glyphosate residues out of your gastrointestinal system. So one of the other things that I wanted to mention here that's more from a bacterial family is there is actually a very big connection with certain types of bacteria, fungus, and even algae that are associated with neurotoxicity. So there is a very specific type of cyanobacteria. It's called BMAA. And we get exposed to it from like oceans, soil, lakes, things like that. But we can also get it from ingesting shellfish, because shellfish are the filter feeders. So this is something that is specifically been known to create neurotoxicity, especially if we get exposed to it in high amounts. So again, this is not necessarily for you to live in fear of what you're eating and swimming in oceans, but it's more so if you're immune compromised, you are obviously a lot more susceptible to this. But I also wanted to make note of this is because Fry Labs, F-R-Y, they specifically have just come out of doing 2 studies. They've been doing these studies over the past, I think, 8 years. The one study isn't even fully released just yet, but they gave us some insight as to what the study has revealed. And pretty much what they've found is that when it came to multiple sclerosis patients, that there was a huge correlation to fungus being what was causing the neurotoxicity. So fungus can be from mold, it could be from overconsumption of antibiotics, it could be from certain foods that are high in mold, like wheat and cheese, especially like blue cheeses, and peanuts and peanut butter. And then they also found a high correlation with ALS, Lou Gehrig's disease, that was actually connected to algae. And this algae was algae that the exposure comes from water and lakes. So I found this to be very, very interesting because, you know, these are different types of things we get exposed to in our environment that are connected to some of these chronic illness and neurological degeneration that, again, we're being told, oh, we have no idea why this happens, and we have no idea really how to treat it other than shutting down your immune system. So with that being said, there is a huge connection to the fungus and the algae. What it does first is it colonizes the vascular system. So then it colonizes the vascular system, and as the blood goes up into the brain, that's how it gets carried into the neurological system. So this is not, again, just about these chemicals that can create neurotoxicity. There are also infections that can cause neurotoxicity. So with all of that, just so you're not completely devastated and living in fear now, moving on from this, this webinar, is that your body is equipped to deal with toxins. Your body is equipped to deal with fungus and algae and all of these things, especially when it comes to fungus and algae. Like, these things have been in our environment for thousands of years. So why is it being connected to chronic illness now? It's being connected to chronic illness now because our systems are being so overly burdened by so many different things. And this is in combination to all of our technology, the Apple Watches, the Fitbits, the AirPods, or whatever they're called, the wireless headphones. Our houses are techie, our refrigerators talk to us, our cell phones are mini laptops. We are constantly being bombarded by technology, and we don't always understand things that we can't see. So we think that all of this technology is completely benign. But what they've actually found is that fungus, mold, will actually multiply by 600% per week with the exposure of Bluetooth, cell phones, routers, all of that. So if you end up getting exposed to some type of fungus from your environment or from antibiotics, then you're wearing your Apple Watch on your body all day long, and you sleep with it and you work out with it and everything else, then you potentially are causing the colonization of that mold within your own body. So this is definitely one of the layers, is all the technology. Then on top of it, we're dealing with an overly burdened immune system, and it's overly burdened because we're being exposed to not one toxin or two toxins or three toxins. Exposed to not just coming from our food, they're coming from our personal products, they're coming from our houses, our furnitures, they're coming from drugs, they're coming from everything. So we're getting hit left and right with all these different toxins, and our immune systems are like, what the hell is going on? And it's pretty much just getting to the point that the immune system can't do what it once did. And I will tell you how this looks in a real life person. So when everybody's young, they go out and have a couple of drinks and they feel fine. And then, they wake up the next day, they can wake up and go to class or go to work and they're great. Then you start to get older and now you're like, oh gosh, I had 2 beers and now I'm hungover for 3 days. So that's not because you're getting old. That's because your liver is less resilient than it used to be. And your liver is one of many different detox pathways of the body. So when it comes to the liver, the kidneys, the lymph nodes, the gut, all of those are the pathways that get the bad stuff out. And then what you're looking at here on the webinar is these are the pathways that are associated with detoxing your brain. You have a whole separate lymphatic system, like an immune system for your brain. But if that immune system is overburdened and your detox pathways are not working, then your brain can't detox. And if you're the person who's waking up in the morning with a low-grade headache, or you wake up with postnasal drip, or you have sinus issues, those are all signs that your brain is not detoxing. If you have weird dreams, if you have vivid dreams, those are all signs that your brain is not detoxing. So it's really, really significant to understand that our bodies are designed to get rid of the bad stuff, but sometimes we need help. We need to use specific testing and specific strategies to get our bodies to a place that it can be resilient again. And that, unfortunately, doesn't always result in just making a dietary change or just taking a few supplements, especially if you are that person that you have brain fog, memory loss. Maybe you are waking up with the low-grade headaches. Maybe you suffer from migraines. Maybe you suffer from high blood pressure. Maybe you also deal with, you have glaucoma, the early onset of glaucoma. Those are all signs that your brain is not detoxing. But your brain could not be detoxing because of vascular issues. It cannot be detoxing because maybe you have really clogged up tonsils. It could not be detoxing because you have had whiplash or you've had head injuries and your cervical spine, your neck is messed up, or you have a bunch of scar tissue in your head because you played hockey or football. So these are all things that have to be taken into consideration that not a dietary change or a supplement are going to necessarily fix. This is also piggybacking off of what I've already just mentioned. So when we're talking about like what makes up the filters, what makes up the immune system, what makes up our ability to get rid of the bad stuff, it's your tonsils, your adenoids, your lymph nodes in your armpits, your appendix, your spleen. All of those things help you get rid of the bad stuff. In reality, think about how many people have had their tonsils removed, adenoids removed, how many people have lymph nodes removed, how many people have had their appendix removed. We're getting these organs removed because we say that they don't really serve that much of a purpose, when in reality, those are all aspects of our immune system. So if you have a child who was literally, 5 years old that had their tonsils were so bad that they had to have them removed, that compromises their brain's ability to detox. So one of the questions is, how do you detox your brain? There is a lot of things that have to be taken into consideration for how to detox your brain. You have to factor in how well is your circulation? Is there any blockages in your circulation? Do you have a bunch of congested lymph nodes in your neck that are causing the inability for the brain to drain? Do you have sinus inflammation? Do you have dental issues? Do you have toxins in your mouth that are affecting your brain? Do you have bad posture? Do you have neck injuries? Do you have scar tissue? Because everybody's brain's going to detox in a different way. And it's going to detox based off of what is going on in the first place. So it's definitely not the easiest question to answer without, you know, the specificities of that person specifically. So speaking of dental, one of the things that can play a very significant role in your brain's ability to detox is actually the shape of your palate. If you are a person who had to have a lot of teeth removed because of crowding in your mouth, you probably have a small palate. And a small palate is going to definitely make it a lot more difficult for your brain's ability to detox. So sometimes, and this is obviously in a very, I don't want to say severe case, but this is really a last resort if somebody is not able to get better. But it's really being able to have them work with a specialist that can evaluate, does their palate need an expansion? I've actually had younger individuals that have had palate expanders, and they've had them primarily because of for orthodontic reasons, and that actually helped their brain tremendously. So another big thing too is dental cavitations. So with that, when it comes to a dental cavitation, this is when somebody pulls your tooth out, and it could be a wisdom tooth or it could be another tooth. It gets pulled, but they don't remove the ligament called the periodontal ligament, which then doesn't allow for the area to heal. And that becomes an area where bacteria will pool. So if you've had teeth pulled on the top, on the other side of your jaw is going to be your sinus. So I've had many patients that have had infections or abscesses that have developed where their tooth was pulled that then pushed into the sinus, which then circulated into the brain. So it's very, very important to take into consideration root canals, teeth being pulled, dental infections, even if your gums bleed. These are very, very, very important things to consider. And for those of you that went and got all of your silver removed, all your silver fillings, because you know you heard that that was bad, and then you got it replaced with your white fillings, unfortunately the white fillings have their own problems. The white fillings have cadmium in them. The other thing about the white fillings is they time release fluoride. So this was actually new information to me that happened over the past few months. That all white fillings contain time-released fluoride. So overall, I'm not going to sit here and say that every single person that has dental implants or bridges or other types of implants or compounds in their mouth, that every single person is dealing with brain toxicity. But it's very, very important that if you've had a lot of dental work, that this is being taken into consideration, especially if you are living in fear of the development of dementia because you're having such significant memory decline. And also too, there are safe materials that exist, ceramic, zirconia. These are compounds that are specifically going to be used by biological dentists. They are not being used by your traditional dentist. So if you are someone that has a lot going on in your mouth, you really need to consider working with a biological dentist in order to improve that. My one disclaimer is that when you're dealing with dental issues, is that you can go and get all of your dental issues taken care of, but if you have a lot of issues with your sinuses, your tonsils, and the lymph nodes in your neck, because you always have swollen glands, you might have adverse reactions because your body's ability to detox might not be working at its best. So you always have to take that into consideration of how well is my lymphatic system actually working, again, your detox system, before you go and start having a bunch of dental work. Something else too, for those of you that do have a lot of compounds in your mouth, there is something called oral galvanism. If you have different types of metals next to each other, like if you have a mercury silver filling and then you have a gold implant or a gold cap next to each other, that can actually create electrical current. And that electrical current can dramatically impact your brain because your brain is electrical. And really the same thing goes if you have different types of implants or metals in your mouth and you are using different types of technologies like your wireless headphones or you're constantly on your phone, you could easily be heating up these different metals and causing them to release vapor into your neurological system. So a lot of us would assume, especially if we're dealing with neurological issues, that we've had the best testing. We would assume that an MRI is going to give us the best amount of it, or the best information. We would assume that a CAT scan would give us good information. We would have the best testing. But it's not, because if you haven't realized at this point, is you need to look at toxicity. You need to look at infections. You need to look at mold. You need to look at autoimmune conditions attacking the neurological system. You need to look to see if gluten is creating a neurological response, because gluten, it's not just about your gut, it's also about your neurological response to gluten. And then in addition, you also have to look at your meridians. You know, there are a lot of meridians that connect into the neurological system. And there is a lot of associations with meridians that tie your gut to your brain, and your kidneys to your brain, and your heart to your brain. So sometimes this is not necessarily always just a infectious toxicity issue. Sometimes there is more to it when it comes to meridians. Meridians, just so you kind of have a basic framework, that's actually the foundation of acupuncture, is helping to remove blockages in the meridians, which is more of an energy medicine. So meridians can become compromised for a variety of different reasons, but you need to take that into consideration so you're not missing anything, essentially. And I would say one of the most unique technologies that we have as well is acute EEG. Most people have had exposure to EEGs, especially if they've had a history of any type of seizures. But there is a more advanced technology called a quantitative EEG, which actually maps out the brain, helps you to understand what parts of the brain are overactive, what parts of the brain are underactive, and it also it allows to utilize a therapy called neurofeedback that actually can help to balance out the hemispheres. So this is very, very interesting, because this actually gives you a map of your brain and how it's functioning. So going back to the dental conversation, I thought that this was a really significant thing to add in here from a case study perspective, is that I specifically worked with a patient who came to me with the early onset of Parkinson's, with hopes to obviously prevent the progression. And when we started to talk a bit more, and we started to really talk about the timeline of the onset of some of the symptoms, which then obviously led to the diagnosis, is that it was really about 3 months prior to the onset of the tremors and some of the other neurological issues that he had about 10 amalgam fillings removed out of his mouth. And this was done by a traditional dentist. It was not done by a holistic or a biological dentist. So in the event that you go in and you start to either crack or remove those fillings, they are going to release vapor. And when you look at how it's supposed to be done properly, both the dentist and the patient are supposed to be wearing what's almost equivalent to a hazmat suit. And if they are not, they are both being exposed to that mercury. And mercury, again, being one of the most neurotoxic compounds that are out there. So this was specifically a person that the onset of their neurological decline was very much associated with mercury that was released from a dental procedure. So again, this is very, very significant, and it's really something that we need to be careful with and we need to educate ourselves with. So when it comes to how can we improve the brain, it is just, there's so many factors to be considered, but this is really, just trying to give you some general recommendations. Balance your blood sugar. Eat breakfast. You have to eat breakfast. If you don't eat breakfast, your blood sugar is going to be on a roller coaster all day long. And I promise you, eating something as small as a hard-boiled egg is going to actually dramatically improve your blood sugar. And when you eat breakfast, it has to be protein. Don't eat waffles. Don't eat cereal. Don't eat crap. Don't eat sugar. Get more oxygen. Breathe. Nobody breathes. So when you go to like a yoga class and you're like panting, or you try to do, like, if you ever gone to Qigong, they're very big with breath. And then you start to realize, like, holy crap, I don't breathe. Breathe. Literally take some time to take some deep breaths in through the nose, out through the mouth. And then obviously another way you can get more oxygen is through exercise. Being able to do some type of cardiovascular exercise. So many of us are sedentary and sitting around, and we're tired. I get it. But once you get into that exercise and you start to release more of those endorphins, which are so beneficial to the brain, you start to feel less depressed and more motivated. So trying to do some type of movement that can give you more oxygen. Eat better fast. Stop being scared of egg yolks. Stop being scared of butter. Obviously choose better quality. Try to get pasture-raised eggs and get yourself grass-fed butter. But 2/3 of your brain is made of cholesterol. So when we go on these low-fat diets, or we start taking statins that are decreasing our cholesterol, we are actually compromising our neurological system. Eat organic, so you're not getting exposed to things like the glyphosate and 262 other chemicals that are on our foods nowadays. Stop using antiperspirant. All of your antiperspirant, your Dove, your Secret, Axe, all of them, they all have aluminum in them. Stop using it, because the lymphatic chain that goes into your armpits, that connects all the way up into your neck, into your neurological system. Raise the headboard of your bed. If you raise the headboard of your bed by putting a couple of books underneath the headboard, and your bed is on the slightest bit of an incline, even if it's 2 inches, that will actually help your brain detox when you sleep. If you're actually looking for more information on this, you can actually check out our website. We have more information on this. Improve your sinuses. If you cannot breathe, your brain cannot detox. So being able to have the strategy that's best for you to get your sinuses working. That doesn't mean Flonase. That doesn't mean any of those types of nasal sprays. It's actually using maybe an oil of oregano nasal spray, or using something called nasal clear, which is another type of nasal spray that's extremely helpful. Get the toxins out of your mouth, or stop putting toxins in your mouth, I guess I should also say. So again, I would definitely say get your body checked before you actually seek out doing anything with your dental composites, implants, metals, because you don't want to make yourself more sick by doing that. Sweat. This obviously goes back to the oxygen and the exercise. You need to sweat. If you're not sweating, you're not detoxing. So getting your body temperature up is very, very important. Learn something new, exercise your eyes. These are 2 things that are really, really significant with improving your brain. Learning something new. We get so redundant in our day-to-day. We go to work, we do the same thing, we cook the same thing, we watch the same shows, and we're never necessarily activating new pathways in the brain to learn something new. And then exercising your eyes. If you wear glasses or contacts, take them out for a period of time. Stress your eyes, work them. Try to really make your eyes do movements and exercise them in a way that they're not used to being exercised. If you're constantly using or wearing your glasses and using your contacts, you're not actually promoting the proper stimulation and muscles of the eyes to actually improve them. And your eyes are connected to your brain. So if you haven't figured it out yet, I'm here to tell you, you don't know what you don't know. It's impossible for you guys to know this unless you listen to my webinars, number 1. Number 2 is your testing is not revealing this. You're not necessarily going through the conventional medical model, and they're testing you for all these different types of toxins. They're not even acknowledging that that's a possibility. And then we're being left to have very limited solutions when it comes to memory loss, dementia, Alzheimer's, etc. So we really need to stop thinking that these conditions are based on bad genes, and we need to just stop accepting the normal. And I mean that for especially the younger individuals that are like, oh, I can't remember anything. Oh, I'm super foggy, or oh, I can't function without my Adderall. Those are all signs that you have early onset neurological decline. I hate for it to sound that scary, but that's the reality of it. And I know that for me, I was very much on that track. And I'm just very fortunate that I got into this industry and was able to figure it out before it became a bigger problem. But I very much so, I think that I potentially could have been in very big trouble at this point, because I have, figured out I had Mercury over 10 years ago now. And I was able to successfully detox from it, but I don't know where I would be now, because not only was I able to get it out of my body, but then I was also be able to reflect on my lifestyle of, holy crap, you need to pump the brakes on all this fish that you're eating, because this is part of the exposure. So the biggest thing about this too, this information, is that, dementia and Alzheimer's, they don't always look like the textbook. they don't always map out to be, the same symptoms for everyone. And if the symptoms don't look the same for everyone, then why would the treatment look the same for everyone? So we need to really start considering what is the root cause. I work with so many patients with multiple sclerosis, memory loss, early onset dementia. Vascular. Some of them is immune condition. Some of it is blood sugar instability. There are so many factors to be considered, and sometimes it's one of those things, sometimes it's a combination of those things. So every single one of those people need to be treated differently. And that's really why I do what I do now, because when I did more of the functional medicine model, which most of you probably don't even know the difference between functional and integrative, but with functional medicine, it was amazing tools from a testing perspective. I was able to do better testing, get more information. I was able to better diagnose autoimmune conditions. I was able to better figure out if toxicity was part of the puzzle. But then when it came to the ways to help people get better, it really came down to diet and supplements. So that strategy only got a patient so far. And that's really when I started to look beyond that of like, what am I missing? What else can I be doing for these patients to help them in a bigger way? And that's how I moved into this model of integrative medicine. And I started to piece together, how can we look at the vascular system? How can we do neurological therapies and piece that together with the supplements and the diet and strategic detox therapies, and being able to have more tools in the toolbox so that people could get better in a fraction of the time. So that's really where we are. And unfortunately, when it comes to the amount of time that all of that takes is to dig deeper, ask better questions, do better testing, and strategically lay out a personalized plan, a lot of that is falling in the out-of-network realm of insurance. And it's not that insurance doesn't cover anything. It's more so that being in-network would only allow for us to spend tops 15 minutes with our patients, which is not going to allow us to get the information that we need. So we choose to serve people and not insurance providers. So the great thing about it is a lot of people use their insurance for their blood work and other labs, and then they also use it to get reimbursed through their out-of-network coverage. But overall, I do think that insurance is going to change for the positive because of the demand that's out there. But right now, the out-of-network is what allows us to do what we do, and also allows people to get the results that they are looking for. Because I think at the end of the day, we forget that healthcare is about answers and it's about solutions. A lot of us have kind of just settled for not really knowing what's causing our symptoms. A lot of us have also settled for mediocre solutions or no solutions of, I don't really know what's wrong with you. Maybe you're depressed. Maybe you're anxious. Or, well, we don't really know the cause, but just take this drug. Or, when it gets bad enough, do this surgery. And I think more and more people are just like, I want more than that. I want to understand the bigger picture. I want to know how to be proactive in my health. So right now, with some of the strategies that we put into place when it comes to how we're getting all of this information, is that you're working directly with myself or Dr. Nick as your head practitioner. You're getting a designated health coach. You're also getting a designated nutritionist. And then we are using a variety of in-house testing in addition to very, very comprehensive blood work. So we're doing everything from DNA-based testing to food allergy testing, chemical allergies, environmental allergies, heavy metal testing, mineral testing, and other types of chemical toxicities. So you get a ton of information. And not only that, but Dr. Nick and myself, we're piecing it together so it actually makes sense. And then that corresponds with a very strategic way to get you better. And that's really where the last one, the autonomic response testing, comes in. So we do not guess, we test for everything. So when it comes down to how are we going to recommend what supplements are best for you, what diet is best for you, what types of therapies are best for you, how should you detox, what types of neurological strategies are best for you, all of those things are tested against your DNA. So none of it is our opinion. It's no cookie cutter protocols. It is actually what your body tells us is good for you to start getting better in the fastest amount of time. So we have customized this protocol over a very, very long period of time. And we have customized it primarily because we were trying to figure out a cost-effective way for you to get the most information about your health, your symptoms, etc., and then be able to obviously spend money on what's important, which is getting better. So when we were doing the old functional medicine model, you would come in for an initial consultation, but you would leave with a variety of different tests that could rack up to $3,000, $4,000, or $5,000. And then you're already a couple $1,000s deep before you actually know what's wrong with you. So we really wanted to change that so we can get better information, but also, try to cut down the cost of that. And one thing I'll say too is a lot of times in this world is like when we have been around the merry-go-round, we've been to 1 million doctors, we paid 1 million copays, we've been poked, prodded, tested, MRI'd, etc. Unfortunately, by the time you get to me, you're exhausted, you're tired, you're burnt out, you're bitter, you're hopeless. But we also, then kind of say, this is my last resort. And we want to go from super symptomatic to cured. We're really good at what we do, I will tell you that. But we can't go from level 1 to level 27. When you're in a video game, you have to master every level to kind of work your way up. So it's the same thing that goes for your health. It's really, we're there every single step of the way to take you through that process, but it's not about going from I'm chronically ill and I have 1 million symptoms and I'm bedridden to 2 weeks from now, I'm going to be radically cured. Some of you might be like, ha ha ha, I can't believe people think that. Trust me. When you're just beaten down and battered and you just have been feeling like crap for so long, I know that people just want to feel better. But again, we're there every step of the way, but we have to make sure that we work on those pieces and those layers that are the most important. So overall, for those of you that have been struggling and nobody has been able to give you answers, nobody is giving you solutions, you don't know what to eat, you don't know what supplements to take, you don't know what the heck is even wrong with you, really depending on your goals and what you can achieve once you know what's wrong with you, it really is priceless. I don't really know, how you can really put a price on health. Obviously, it always has a price, but overall, it's really being able to understand your body and being able to prevent something like dementia and Alzheimer's. I don't really know if you can actually put a price on that either. But all of our testing that we do, everything from the cost of working with your health coach to your with the doctor, the nutritionist, all of your testing, including the autonomic response testing, the bioresonance, and all of the other tests that I mentioned, that falls under the onboarding price of $19.97. I know some of you that are new to this world might be like, holy crap, that's a lot of money. Totally get it. Again, I will tell you, as most other facilities, you are going to be paying more than that in all of the lab testing that you are going to outsource. So you're going to be paying those dollars to the blood lab, the food allergy lab, etc. So you get all of our testing, which will give you the most information under this price with no additional cost, so there are no surprises. In addition, if you seek out bringing in your family, they all come in at a 50% off rate, which is pretty amazing for family members to be able to do this together. So we always want to make sure that you are a good fit for us as we are a good fit for you. I'm always so bad at finding where this button is. So we actually do request that you apply. And I primarily just say that because we like to tell you a little bit more about how the whole process works. And then if you are like, that's fantastic, then you're a great fit. But also it's really just a matter of knowing that, we are playing a role in this just as much as you. So we're there every single step of the way, but it's really just being able to know, is this something that you're willing to do and commit to? We do work with people long distance, which is pretty amazing. Because a lot of our tests are DNA based, you have DNA in your hair. So by simply sending us a hair sample, we can actually do most of your testing from a distance. So I want to end with this because I think it's just so important. Just because it's the way it's always been done doesn't mean it's right. And when you want to quit or you're super skeptical, that is because that is the end of your skill set, not mine. And I say this with love. When people are new to this world, how all the therapies work, or what are they? How do you do DNA testing, etc.? Why is this so different? Primarily just because it's the way it's always been done, aka drugs and surgery, doesn't mean it's right. It might be right for a lot of people, but it's not right for everyone. And it doesn't mean it's the only way. And in addition to that is just because you're skeptical and don't understand the technologies, that's because that's the end of your skill set. That's the end of your knowledge base on this. So I do what I do on a day-to-day basis because it works and because I see people's lives radically changed. And that is truly the most important thing to me, is if I would never do what I do if I didn't get results. Results are the most important thing, and that's why people come to us. So I want to see if there was any questions that anybody posted here. I don't have any questions. Okay. So I'll give you guys the next minute or two to add in any questions that come up. But overall, I definitely appreciate you guys being here with me. I absolutely love doing these webinars. They're one of my favorite things to do. I hope it wasn't too overwhelming today, because I know it is a scary thought of how many chemicals we are exposed to on a day-to-day basis that are potentially harmful to our neurological system. But, information is power, and being able to understand this and be proactive in it is really just so significant. That's really where it starts, is education. And then once you're able to know what your body needs, that's when this truly becomes a breakthrough experience. So I really hope that all of you can experience that at some point with your health, of being able to, really just feel good. I think a lot of us forget what it's like to feel good, or don't even really know what that means anymore. But everyone deserves that. And we also deserve to live a life that we enjoy and not live in fear of what our parents got, or live in fear of, what our genetics tell us. There's so many factors that contribute to genetics being turned on or off. And just because you have a gene does not necessarily mean that you are going to be doomed to get that condition. So if you're looking for any more information about us, as well as even tons of podcasts, I know that somebody asked mainly on Instagram about how to detox the brain. We actually just put out a couple of podcasts about the brain. One was about the cardiovascular system of the brain and how it's tied to like migraines and headaches. And then we also talked a lot about melatonin being a master detoxifier of the brain. So if you're looking for a bit more information about the logistics on the neurological system and how you can strategically detox, of course, under the supervision of doctor, you could definitely check out those podcasts, and we give you a lot of amazing insight there. All right, guys, so this is the last one of August. We're going to be kicking off in September, and we are going to be talking all about allergies. We're going to talk about everything from seasonal allergies to chemical allergies to food allergies. So lots of good information to come. So definitely keep an eye out for that webinar, and I will see you guys next month.